Good afternoon. So I will be talking about Part B MRCS stations regarding the examination part. For the lower limbs, the different commonly asked stations are examination of varicose veins, examination of the diabetic foot. There can be also something, there can be a neurological examination in the case of foot drop. So I am presenting a case of varicose veins. In this, after entering station introduction with my candidate number, then I will do sanitize the hand, then introduce myself as a doctor, surgical doctor here, ask the patient's identity, then explain the procedure. So today I am going to check the veins of your leg. It involves looking at the leg, touching it and feeling. Are you having the pain? If the patient says no pain, so ask him to stand. So the patient is having the gown, so I will just ask to uncover because I just want to examine the leg varicosity right from the hip up to the foot. So I will just uncover it, expose, thank you. So this involves first looking at this has to be exposed up to the hip joint. So up to this side, so the veins. So first of all, the inspection will involve looking at patient in standing position from the front, on the medial side, any dilated veins, then eczema, ulcers, or from the side, from behind. Then you can see some of the discoloration. Ask the patient to cough. Okay. Asking to cough and see any bulges there on the middle side. If so, the varicosity on the right side, so that will give. And look for the edema on the ankle side. So that will give you little bit edema. So next I will be just palpating it, looking at his face. So whether person is having tenderness on this medial side, along the length of great syphilis vein, this side, then posterior side, at the level of short syphilis vein. Then ask the patient to lie on this. So check for this lymphadenopathy, swellings on both sides, look at the both sides. Then again you just put the hand and ask to cough. So you can check the blowout. If something is blowing, you can check. Then you have to palpate the peripheral pulses. So start palpating the dorsalis pedis. This is the extensor pollicis tendon, lateral to that dorsalis pedis. On the medial side, you see posterior tibial, then popliteal behind the knee joint, popliteal fossa, then femoral. This is the pubic tubercle. Then below that, femoral pulsations. So after the palpation, then I will do some special test. So what to do in this special test is that this is the anterior spine, this is pubic tubercle. You have to palpate the femoral artery, and medial to femoral artery is the femoral vein. So at the junction of great syphilis vein and the femoral vein, 2 to 3 centimeter below the pubic tubercle. So ask the patient should be lying totally flat. Lift the leg up like this. So empty the veins completely. Then after emptying, you have to press the cephalofemoral junction and ask the patient to stand. So I am still keeping this saphenofemoral junction pressed and the patient is standing. So if I just suddenly release, if the vein is filling, it means that there is incompetence. And again I will ask the patient to lie down. So this is just to test the saphenofemoral. If saphenofemoral is competent, repeat the same, empty the vein. If saphenofemoral is incompetent, just empty the vein, tie the tourniquet. This is saphenofemoral junction. The tourniquet is tied at this level, 10 cm below the saphenofemoral junction. So it will be a little bit tight, and ask the patient to stand. Over. So when the patient is standing, the tourniquet is tied, the saphenofemoral, the veins, if it is dilated below this, I have to go on repeating this by moving it down 10 cm. So this is tourniquet test. So after doing this tourniquet, so another test which we do is the Doppler test. So what is done in this? A color Doppler is started and we check the Doppler is working. So there are 2 points. One is the saphenofemoral junction and this is the popliteal junction. So you have to keep this Doppler at 45 degree at saphenofemoral junction. Then this is the cuff. You squeeze the cuff and listen the sound when you release. So if you are getting 2 sounds while squeezing and again releasing, so that will show saphenofemoral incompetent. And the same, you put the Doppler on the popliteal junction, you squeeze the cuff, release it. If you are getting 2 sounds, so popliteal saphenous incompetence. So this is short saphenous incompetence, this is the long saphenous incompetence. So this is about the next station, having a stem-like GP is sending the patient with a lower limb pain and claudication and ankle brachial pressure index. You have to measure the arterial examination and introducing yourself with the patient and hand washing and all that. So I will be just explaining the procedure. I will be checking your arteries of the lower limbs. It involves looking it, feeling it, measuring the blood pressure on the limbs, upper limb and the lower limb. If you are having pain, please let me know. I will be just giving the painkillers. So ask the patient to stand, then remove the gown and start by doing inspection. This by seeing the hands, any scars, stains, look for the hemorrhages, trophic changes on the skin, on the lower limbs, on the upper limbs. So look for the hair loss, muscle wasting, and so I'll just ask the patient to lie on this. For lower limb inspection, so I will be looking at the hemorrhages, ulcers in between, any ulcers in both the legs, then medial and lateral malleoli, or any trophic changes. So this is the inspection in this class. Now for palpation, I will be just touching from the back of hand. So temperature on all the limbs, then C4 tenderness, looking at the face. If the person is having tenderness, then check the capillary filling. Look at the capillary filling, it has to be 1 to 2 seconds. Then edema on the limbs. Then I will be palpating the peripheral pulses. So it starts from pulsation again, dorsally spaced, posterior tibial, popliteal, femoral, for the arms, radial, brachial, and carotid. If there is a groove, auscultate femoral groove. So if there is no groove, then I will be doing, this is the very important point. So one test, that is the budget test, special test. So what I will do, just look at the angle, lift the leg, see the palate. Normally it has to be up to 90 degree. The leg should not get pale. If the person is getting pale at this side, just once after 2 to 30 seconds, ask the patient whether he is having pain in the joint. If it is no, then ask him suddenly to stand and look for the hyperemia. So if there is So this is the station about diabetic foot. In this you have to check about diabetic neuropathy or something. So after introduction, greeting to the examiner, entering into the station, cleaning the hand, washing the hand, introducing self to the patient, and explaining that I am going to examine their foot as well as legs. It involves looking it, touching it, moving it, asking to walk. If the patient is having pain or difficulty, then I will offer him the painkiller and watch for the any walking aids patient is using or his footwear. So how is the type of footwear? So that I will see. So ask the patient to stand, undress the patient so that it be easy to examine. Then ask the patient to walk. So look for the gait. So on inspection, look at the legs, extremities, the hairs, the tissue loss, the ulcers, and ask the patient to stand. This is the lumbar test. If the patient is to give him the support. If the patient is falling, okay. So inspection for the deformity on the spine, wasting, and so now I will be examining the tone of the muscles for the lower extremity. So as this is the check the leg growth. If the tone is less, so this is looking at the tone. Then see the flexion, extension of the hip, flexion, extension of the knee, flexion, extension of the ankle, flexion, extension of the great toe. Then I will check for the reflexes. So it has to be checked by the hammer. So this is the ankle reflex. So just to hit the hammer and check the hammer, ankle reflex, and this is the knee reflex. So this will be the on the both the legs. The reflex are on both the legs. And check the sensation on the chest with the cotton. If the person is feeling here, check the sensation on the legs, on the tips of the toes, both the toes. Then proprioception. So proprioception is ask the patient that I am going to make this great toe. This is up, this is down. Ask the patient to close the eyes. Hey, what are you telling me? So person is able to identify this is a proprioception. So joint vibration, this is the tuning fork. I will just putting this tuning fork, whether you can feel the vibration. So this is the joint vibration. So now check the peripheral pulses. All the dorsalis pedis, popliteal, radial, this is posterior, and also check the Varicose sign. Just strike on this and you will do the Varicose sign. Stop.